A blood clot can kill your heart or your brain, but some drugs can dissolve it fast. Doctors use special medicines to break apart dangerous clots. They're called thrombolytics. If a vessel is blocked, blood can't flow. These drugs work to open it again. A heart attack happens when blood can't reach the heart muscle. No oxygen, heart tissue starts dying. A stroke happens when blood can't reach part of the brain. Brain cells die within minutes. Clot-dissolving drugs break up the blockage. Blood starts flowing again. More blood means more oxygen means less damage means better recovery. Before treatment, your doctor needs the full truth. Every detail counts. Tell your doctor everything you take: prescription medications, painkillers, herbs, and even supplements. Some drugs increase bleeding risk, like Coumadin, Xarelto, heparin, and aspirin. Even natural products matter. Garlic supplements, fish oil, vitamins, they can increase bleeding too. Tell your doctor if you've had recent surgery, head injury, bleeding ulcers, pregnancy. Time is very critical. Clot-busting drugs must be given fast. Delays mean more damage. For heart attacks, these drugs work best within 8 to 12 hours. For stroke, the window is much smaller, usually within 3 hours. Doctors give the drug in one of two ways, either IV or via a catheter. In emergencies, the drug goes straight into a vein. Fast action, fast results. Sometimes doctors go straight to the clot using a thin tube called a catheter. It enters through the groin, arm, or wrist. The area is cleaned and numbed. Doctors use X-rays and special dye to see blood vessels clearly and target the clot. The drug is released right at the blockage. Sometimes tools help remove it. The procedure can take minutes or a few hours. After treatment, you stay in the hospital. Doctors monitor you closely. Follow-up visits matter. They track recovery and prevent future problems. Every procedure has risks. Doctors weigh risks versus benefits. The following bleeding risks exist: bruising, bleeding at the site, rarely bleeding in the brain. Other possible complications include the following: irregular heartbeat, low blood pressure, allergic reactions, and kidney problems. That's why doctors ask many questions. Safety always comes first. And now here is a big takeaway. Clot-dissolving drugs can save lives and protect the heart and brain. Heart attack or stroke? Every second matters. Fast treatment saves lives. Don't delay. You can learn more from the National Institute of Neurological Disorders and Stroke website and NHS Choices. If there's one message you take away from this video, let it be this: a clot doesn't wait, and neither should you. Seconds decide how much heart muscle survives. Minutes decide how much brain is saved. Now ask yourself, who do you know that needs this information today? Because knowing when clot-dissolving drugs work can mean the difference between recovery and lifelong damage. Hit the like button so this life-saving education reaches more people. Share this video widely. One share could save a heart or a brain. Subscribe for clear, simple medical explanations that actually save lives. Turn on the notification bell so you're always one step ahead in an emergency. And drop a comment below. What surprised you most about clot-busting treatment? Your engagement pushes this message to the people who need it before it's too late. Every second matters. Act fast. Save a life. Thanks for watching. I will see you in the next video.